Alright guys, today we'll be doing a basic overview of vasopressors. We'll talk about what they are, what they're used for, some common types, how they work, and kind of things to monitor for. So just starting off here, we'll start with what are vasopressors. Okay, so vasopressors are commonly used in the ICU, and these are going to be medications that cause constriction of your blood vessels. That's going to lead to increase in your blood pressure. So medications that constrict your blood vessels, which leads to an increase in blood pressure. This constricting of blood vessels here, this is what we call vasoconstriction. So vasopressors are going to be used basically to treat hypotension, right? And trying to increase your blood pressure. So some common things that might cause hypotension or might need vasopressors to correct. It's going to be things like sepsis, or septic shock if it progresses, heart failure, cardiogenic shock, anything that can cause your blood pressure to be low, right? So a drug reaction, or maybe even like a heart attack, poor perfusion, anything where your blood pressure is inadequate, it's too low, needs a little assistance to continue to adequately perfuse your organs. We'll just put etc. here. So that's just a few examples, but could be used for a lot of other things as well. How it works, we won't get too into detail in this video. I'll do a later video that goes into more of the receptors and how different vasopressors work here. But like I said, so it's going to constrict vascular smooth muscles within the blood vessels. So constrict smooth muscles within blood vessels. That's going to increase your blood pressure. That vasoconstriction is going to lead like tightening the blood vessels, right? So it's going to cause an increase in blood pressure. We'll go into the receptors in separate videos when I'm going over each vasopressor, but the most common receptor these vasopressors are going to use is going to be your alpha-1. So your alpha-1 receptor is your most commonly where the drug acts for these vasopressors, and this is going to cause, so activation of this is going to cause vasoconstriction. So that's just a very brief overview there, and kind of get you aware of alpha-1 receptors. Like I said, we'll cover it in more detail in later videos. Next thing I just want to cover is common types of vasopressors in the ICU that we see. So first and foremost, the most popular one is going to be norepinephrine. This is also commonly referred to or known as Levophed. Levophed is going to be, this one is your first line treatment for sepsis. So you will see this one very commonly in the ICU. Definitely the most popular vasopressor. The next one is going to be epinephrine. Epinephrine's also commonly used. It's really common. You'll see it's part of the ACLS protocol, so you'll see it commonly in cardiac arrest, maybe patients that might be bradycardic and hypotensive as well, which we'll get into more details there when I cover epinephrine later about different receptors, beta 1, beta 2, alpha 1, alpha 2, and how that kind of plays. But epi's in your ACLS protocol, very common. Another super common vasopressor you'll see. Vasopressin is another one. This one works a little bit differently. It still does cause vasoconstriction, but uses a different receptor, not your typical your alpha 1 receptor. It uses something different. It also has a antidiuretic effect. So that is going to increase water reabsorption in the kidneys, which is also going to help to increase your blood pressure. Another good thing to know about vasopressin is a lot of times it is be a fixed rate, so you might not be actively titrating this one like you would like a norepinephrine. So a lot of times it's typically a fixed rate. It can be titratable, it just depends on your order, so I have to check that. Those are the most common, the three most common by far. If every ICU nurse is going to have to be very familiar with these three there. There's two more I wanted to talk about though. I will say this one will do phenylephrine. This is also referred to as neo or neosynephrine. We don't see this one as commonly. There is good indications for it, like let's say a patient is tachycardic with low blood pressure. This one doesn't have any beta 1 activation, which, like I said, we'll get into a different video later. So this one shouldn't cause any tachycardia, but this one very common in surgery. So maybe if they're coming back from the OR, seems like a lot of anesthesia providers like to use this one. Very quick onset and rapid onset and pulling it off as well. And the last one I wanted to talk about was dopamine. So dopamine is a dose-dependent drug, which just means that different doses is going to have different, it acts differently. For the vasopressor, it's going to be the high dose. High dose is going to act as a vasopressor. For dopamine, pretty rare that we see it, super high dose and it's acting as a vasopressor. A lot of times you'll see this could be low dose, which means it's a renal dose, which is just helping to perfuse the kidneys, or a mid dose, which is something you could see more of like a positive inotrope, which that's another, we'll cover inotropes as well later down the line. But these are the five most common vasopressors, especially these first three here. These are definitely must-knows for any ICU nurses as well. So it's just a very basic video introduction video into vasopressors. We'll cover more of these in much greater detail later down the line, so please be on the lookout for that. If you learn anything, appreciate it if you like and subscribe. Thank you.